Well, in this Derm Myth Monday, when upsetting things happen, sometimes people say that the situation is giving them gray hair. Well, we're wondering, can that really happen? We brought in Dr. Shoshana Kindred. She is a board certified dermatologist and owner of Kindred Hair and Skin. Welcome back.
Hey, thank you. Good to be back.
I'm happy to have you here. So I'm wondering, what causes premature gray hair?
So premature gray hair is where it appears a lot earlier than one would expect. So maybe in their 20s. And protein deficiencies, micronutrient deficiencies like copper or zinc, calcium deficiency, thyroid disease can all cause premature gray hair. And the most classic one, vitamin B12, also can cause you to gray earlier than expected.
Interesting. Okay, so I'm wondering, when we see one of these and we pluck them, I know that there's a myth that if you pluck one, then two will grow back. We have to ask you, is that myth true?
I wish it was true, right? For all my hair loss patients, we would just sit there and pluck all their gray hair so more
Right,
hair
to
would
be
come in.
thicker.
But no, it doesn't. It's just that particular follicle ran out of melanin. As simple as that. It's the part of our aging process.
Okay, so it doesn't mean that more is going to come back. But what are the treatments for gray hair? You could pluck them, you could dye them, but what are the treatments?
So there are little to no treatments. It just so happens that a procedure that we do called platelet-rich fiber matrix, and we do it mostly for hair loss, will actually turn gray hairs black, believe it or not. Aside from something as cutting edge as that, is just our regular hair dye.
And
That
that
we
seems
use.
like it's a byproduct of treating a different situation, correct?
That's how we figured it out. Yes, we were using it where we use your own blood. We draw the blood, extract it, and inject it back into the scalp. And we were seeing gray hairs come in patients that we knew for sure. We saw black hairs come in, and where
Right.
we knew for sure the patient was gray.
That is interesting. All right.
Yeah.
Well, these are the type of things that, of course, the layperson would never know. Your practice,
Right.
tell us just a little bit more about it. I know we have you on the show every single month, but just remind the people your hair and skin, but you have a whole plethora of services that you provide.
You're exactly right. So I am a hair geek. We totally specialize in hair loss, and we offer growth factors and 3 different methods. We also treat skin of color quite well because I trained at Howard University in dermatology. We offer chemical peels and laser treatments. And I like my regular run-of-the-mill medical dermatology, acne and eczema and psoriasis too.
So it really is one-stop shopping. And for the whole family, do you take all ages?
We do, from our newborns to my grandmas, everybody.
Okay. Wonderful. All right.
Yeah.
And then some of these derm myths, like we were talking about, or hair myths in this case, with, plucking of gray hair or things that we see online that we want to try. You break them all down in a book that you wrote, correct?
Yes, that's Derma Myth, breaking the cycle of skincare myths. And I'm really trying hard to break this cycle, but you guys keep coming into the office with more myths. So I'm never going to run out.
They're churning them out, and it's not our fault because we go on Instagram, we go on Facebook, we go on Twitter, and we see all of these things. So I'm glad that you are cutting through our social media noise and helping us out. Where can we get that book, and where can we get in touch with you?
The book is available on dermamyth.com. Also, just our website, kindredhairandskin.com, or give us a call at 443-HAIR-SKIN.
All right, Dr. Shoshana Kindred, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.